Good morning, friends. This is from Sagar Chandramma Hospital, and today we are going to speak on should I freeze my eggs? A session that will be taken by Dr. Sapna, an expert fertility consultant, and I hand over the session to her. Ma'am, over to you, and I'd like you to introduce yourself and also take the session forward.
Thank you, panel. This is Dr. Sapna, fertility consultant at Sagar Chandramma Hospital, Baswangudi. Egg freezing is a condition wherein the oocytes are produced from the ovary, which are responsible for a pregnancy in the woman. The eggs, which undergo fertilization with the sperm in the tube and form an embryo, this embryo gets implanted into the uterus and is responsible for a pregnancy to occur. Correct? When we tell this, we require the main genetic material from a woman, which is called the egg. Eggs can be freezed during the ovulation time, means any time when the patient wants, willing, especially in patients who are detected with a cancer or early precancerous lesions of any part of the body, and they are not yet married or married and not planning for pregnancy, can always approach this treatment wherein we give the injections for the eggs to grow, and under anesthesia or mild sedation the eggs can be retrieved and washed and then can be preserved. By doing such process, later in the stage after the treatment of the patient, if she plans for the pregnancy, these oocytes which have been freezed can be used for embryo formation and implantation into their own uterus. So these will be the primary patients who will be approaching for oocyte freezing. Other than cancer patients, there are many other category patients who can approach this treatment, like patients who have been divorced and elderly patients who are not yet planned for pregnancy but willing for the pregnancy at the later age, patients who have other health issues can always plan this procedure, who are career oriented, want the pregnancy at the later stage of life. Yes, they can also plan for oocyte freezing.
What are the advantages of oocyte freezing?
Oocyte freezing is a procedure wherein our own genetic material can be used at the later phase of life. Like you consider a patient or a candidate who is 25 years, okay, and she is planning for the treatment or divorce or any other problems or career oriented, whatever it is. She is not planning for pregnancy as of now, and later at the age of 35 years, she tends to plan or she wants her own pregnancy. That time she need not regret on the oocyte quality or the number, because such patients, when they have freezed their oocytes, the oocytes remain as the age when they have freezed. Like if she has freezed the eggs at the age of 25, they remain of the age of 25. So pregnancy rates are better and their own genetic material can be used. Is the advantage, their own genetic material, to be basically speaking, their own genetic, especially not only the oocyte freezing, even semen sample can be freezed. The sperms can also be freezed for the patients who are undergoing treatment, who are undergoing the anabolic treatments, steroids, who are taking any other procedures where the sperms can be affected with the treatment. Such patients may 2 to 3 samples of the semen can be stored and can be used for the later stage when they are planning for pregnancy. It is mainly concerned to the fertility process, wherein the own genetic material, when they are young or when they have a sufficient amount, can be preserved, and later when they want, they can use that. The genetic material will be retained. Yeah.
How is this process done, ma'am? The oocyte freezing, how does it take place?
Yeah. Oocyte freezing is a simple procedure wherein the patient comes on the second day of the period or irrespective of the periods, we'll do the basic evaluation like her hemoglobin, thyroid, basic serology, and the general health checkup. If the patient is all eligible for that, then we do the scan, basic baseline scan, wherein the follicular, antral follicle count of the ovaries are seen, and then we make a fixed dose of injections, and the injections are given every day for about 10 days. Once the injections are given every day for 10 days, in these 10 days, we monitor the growth of the follicles via the follicular scan, which can be done transvaginally or transabdominally, and the dose is increased or decreased, and once they attain about 18 to 20 mm, the follicles attain 18 to 20 mm, we give the injection for it to mature. That is called the trigger injection. And after giving the trigger injection, exactly 34 to 36 hours में, under sedation or under mild general anesthesia, we do the egg pickup. There will be no cut, no laparoscopy, just the internal scan via which the oocytes are retrieved with a special technique called the oocyte retrieval under ultrasound guidance. Then these eggs which are obtained via the procedure will be washed in the lab, and the best quality eggs which are mature M2, that is who have been well maintained, will be freezed with the help of vitrification. In such cases, minimum of 7 to 8 eggs are recommended for the freezing to get a live pregnancy, about 60 to 70% chances. Not all the eggs which are freezed undergo embryo formation when the sperms are put. About 70%, 80% oocytes which are freezed will be maintained in a good quality, and which may form the embryo when sperms are put. And these embryos, when introduced into the uterus, may attain pregnancy or may give a pregnancy in 70 to 80% of the patients. So we require minimum of 7 to 8 good oocytes to give a pregnancy of 70%.
Is this procedure safe, ma'am?
Yes, it's very safe and it's legally approved also, provided the patients should have a basic knowledge and information, and the consent form should be taken from the patients regarding what we are doing, why we are doing, purpose of doing, and also the procedure cost should be detailedly explained, and the procedure should be clearly explained in their understandable language to the patients to follow the procedure and do the procedure. To be very frank, the candidates who are mainly for this oocyte freezing are elderly patients, or the patients who are more career oriented, patients who are diagnosed and planning the pregnancy at the later phase of life, who are diagnosed with other abnormal problems in the body like other liver, kidney problems, and want to take treatment and plan pregnancy at the later stage, and patients who are undergoing kidney transplant, liver transplant. Such patients, they are young, but they want their pregnancy to be achieved at the later phase when they are all fine. That time also this procedure can be carried on. Patients with cancer, precancerous lesions or cancer detected not only for the uterus and the ovaries, any other parts where they require they want to undergo the treatment first for cancer. Such patients with 10 to 15 days of injections and this procedure can be done, and then later they can plan for their treatment whatever possible, and after the break they can come back for the pregnancy planning. And once the oocytes are freezed, they can be freezed from 1 month to 10 years. That any time they can use the genetic material which has been freezed.
So when one wants to freeze their eggs, what are the formalities involved, like legal formalities or documentation?
Documentation, that is legal documentation based on their criteria, what exactly they are come for, detailed history, detailed examination, the basic evaluation of the patient, and the counseling of the patient, and consent form. Then we can explain the financial aspect also, and a procedure also should be explained in detail, and can be carried out.
You have been in this field for quite some time.
Yes,
so what is your
20 years.
what do you think about the future of
Yes.
oocyte freezing?
Yes, I'll tell you my own patient's example. 2 patients were there. Many have come for the oocyte freezing. Especially what I have seen is 3 to 4 actors, the film industry actors who have stored them, their eggs. Not only them, many patients have come. One patient who was just 18 years and she had pain abdomen. Everything was evaluated and on scan done showed a huge mass in the liver. And when biopsy was done, it was diagnosed to be a precancerous lesion. When that patient came to me, I counseled her detailedly about the treatment plan, because they were affordable and they wanted the genetic material to be preserved, and they had taken already the session for how it is, what it is. So they had come for the treatment, directly for the treatment. I explained them everything, and then this was 5 years back. I did a 10 days injection protocol. Then I removed the oocytes. We got somewhere around 12 oocytes, 12 eggs which were freezed. And after 5 years, she got married, and she came back to me with her husband to have a consultation. That time we explained everything, and their embryos are formed and yet to be transferred, and we are wishing all the good luck for them. And this was a very genuine patient, and I have seen the happiness in their face. To be very frank, pregnancy has not yet occurred, but they came to know that yes, it is possible, and their own genetic material is there. And however, our ovary is also restored, and we can stimulate her also. But still, since she has freezed her oocytes, she wants to use her oocytes first and then plan for the later thing.
So what if they give it for freezing but they don't use it?
Yeah, that's see. Every year they have to freeze. They have to pay the renewal amount, or they have to give a consent form that they are planning for continuation of the freezing procedure. If they are not willing, they have to give us in a written consent. They are not willing, and it can be discarded, or it can be used for other research purpose, or it can be used for any other purposes. If they give us in a written consent, then that can be used in the later part. Or if they are willing to continue, we can store it up to 10 years.
If they don't want it, do we give them a refund or something?
No.
Okay.
It's not the thing, because the injections have been used. Okay, the procedure has been done, and it is already stored, and storage, everything has been maintained. If they want to discard, we can do that. If they want to give it for a research purpose, we can give it. Or they want to use in the later phase, that can be done.
Let's answer the question, like, should
Yes.
I freeze my egg? So yes or no?
Yes. Patients who are genuinely involved in such what all I had told categories, like not want pregnancy but not planning as of now, age is running, career oriented, detected with any other health problems, detected with the cancer, and want better life future. Now they are not at all willing for pregnancy. All these patients, please don't think lightly that later we can think. Please come down, take a counseling, take a session, know about the merits and demerits, advantages. Just take a consultation if you wish. Please come down and undergo the procedure wherein the oocytes are freezed, eggs are freezed, and can be used anytime in 10 years. And I definitely recommend this procedure for all the patients, all the women who are willing to have pregnancy at the later phase of life. Okay. With their own genetic material. That is the main intention. It's the own genetic material.
We have a question from the audience. Someone is asking, at what age should she freeze her eggs?
Freeze from the age of 20, or at the age of 18 also. If they have any other problems, at the age of 18 also they can start the treatment. And the minimum age is 18 and the maximum age is up to 40.
Okay, ma'am. Thank you very much, and that was a very informative session. So we look forward to more sessions like this.
Thank you, panel. Thank you for all the people. Wish you all good luck. Thank you.